So diabetes is a problem with metabolism and in particular how the body handles sugar. And sugar is one of the primary energy sources that we all need in our cells. There are two kinds of diabetes. Type 1 diabetes often onsets in people under the age of 40, often children or young adults, and requires insulin as the mainstay of treatment. The other kind, which is more prevalent, 90% of all diabetes, is type 2 diabetes, and that often onsets. Typically, it was people over the age of 40, although more recently we are seeing it onset in younger people. And this diabetes often starts off because people have a sedentary lifestyle and have gained weight. And we can often treat this with lifestyle, losing weight, getting more active, eating a better diet, and then we often go on to tablets, but ultimately many people who have type 2 diabetes also end up on insulin. Diabetes involves a lot of work on the part of the person who has the problem. It often involves paying attention to what they eat, preparing food a certain way, eliminating things that have a lot of sugar in them. So it requires some education around how to eat, and we all eat, every day. So it's an important part of the education and training process. The other part of diabetes often revolves around taking medication, and whether that is tablets or insulin, there's often a regimen that is required to take their medication properly. The third thing is monitoring of blood sugars. And depending on what your treatment is, you may have to monitor, every time you eat or just once a day or a couple of times a week. So you can see that the patient has to do a lot of work on a daily basis to manage their diabetes. It's estimated that about 9% of all Canadians have diabetes. Around 1% of all Canadians have type 1 diabetes. So the remaining 7 to 8%, depending on which province and which part of the provinces you live in, would have type 2 diabetes. It also is a disease that gets worse as you age. So in people over the age of 70, for instance, type 2 diabetes may be as common as 20% of the population. So I've mentioned the main constructs of what's necessary to do with diabetes, and all aspects of the regimen or the plan or the treatment for diabetes have changed. So we've learned a lot about the diet. So when you were first diagnosed 50 years ago, you actually weren't allowed to eat a lot of carbohydrate because we didn't have the tools to manage the blood sugar response. So the diet has become much more liberal, and people have a broader approach to their diet. There's actually very few things you cannot ever eat. Simple desserts would be an example, and simple sugar would be an example. The second part is our therapies have improved tremendously. So we have newer insulins that are safer, easier to take. We use a pen or a pump sometimes for delivering insulin. 50 years ago, it was a syringe that you had to boil on your stove. So, certainly the advances have been tremendous. And I think if you have a television, you've seen the flash monitoring, which is a new way to monitor without picking your fingers. So starting in the early 80s, we developed a way of measuring blood sugar at home. And that was a huge innovation because prior to that, we were measuring urine, which was not very accurate or helpful to the patient. So we thought picking your finger, measuring your blood sugar up to 7 times a day was a great advance. But now we have a sensor that you can just put on for 2 weeks, hold the meter up, and you can check as many times as you need to check, and you don't have to pick your fingers. So that's just kind of an example of many of the things that have changed. Unfortunately, around the world, obesity has continued to increase. And if we can find a good therapy for obesity, we might be able to prevent or at least delay the onset of type 2 diabetes. With type 1 diabetes, islet transplantation has had many hiccups along the way and is still not the cure. So we continue to look for the cure. But in the meantime, we do have the development of, the closed loop pumps, which with a sensor, allow the pump to act almost like an artificial pancreas. There's still, batteries and things to change, but it is moving in that direction. In addition, we have insulins that are in development. We have new glucose sensing insulin molecules, so that if your blood sugar is low, the insulin stops working, which is an amazing advance, because insulin, when you inject it, just keeps working, doesn't matter what your blood sugar is. So there's, pharmacologic maneuvers that are changing for the treatment of type 1 diabetes and type 2 diabetes, but there's also, some technology solutions that are very helpful, like our, flash monitoring. So I think we're going to continue, to develop and evolve with these products. I'm always optimistic that eventually we will find a cure for type 1 diabetes. Type 1 diabetes may be easier to cure than type 2, because type 2 is not a genetic disorder, it's a lifestyle disorder. So it may be harder to find a single solution. For type 1 diabetes, if we can figure a way of doing, cloning of islets and packaging of those islets so they're safe, and maybe we don't need immunosuppression, we then could potentially cure diabetes. So there are so many people working on these solutions around the world that, I'm always optimistic that we will find a cure for type 1 diabetes.